Hi everyone. Today we'll be going through Public Health 101, where we'll define health, define public health, and look at where community health workers fit in the overall healthcare structure. So what is health? The World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So if you look at the graphic to the right, you'll see that the person in the middle is part of a much larger system of influences that affect their health and well-being. We have to look at health as a broad definition that encompasses more than simply just the diseases or illnesses that a person can experience. Health is measured by our ability to function in productive ways. Our health has many parts or dimensions that work together. They include the physical, which is what we do to take care of our bodies to keep them well, including weight, blood pressure, eating healthy, exercising, wearing a seatbelt, and staying away from risky behaviors. And it also includes our family history. For social, having comfortable and respectful relationships with others, including family, friends, community, faith-based memberships, work, and other activities. For emotional health, it's the ways in which we express our feelings. It also means being able to express a full range of feelings in socially acceptable ways, including positive and negative feelings, or what you do with anger, disappointment, frustration, and others. For spiritual health, being comfortable with ourselves, our value system, and the meaning of purpose in life. It can include participation in formal religious activities as well. Environmental health is about the environment in which we live. So home, community, work, school, your state, your country, and even the whole world. And how we feel about it can impact our health. What do we do to improve our environment? Well, we can recycle, we can be positive where we live and work, we can help to keep our home and our community safe. All of these impact us and others. For intellectual or mental health, it refers to our ability to realize our full potential, manage the stress of daily living, work productively, and make meaningful contributions to society and to those around us. Then occupational health is the ability to work with others and contribute to family, community, work, or professional related activities or projects. Now moving from health to public health is defined by activities to protect and improve the health of individuals, families, and communities. Public health also aims to improve health outcomes. Health outcomes are measured changes in health that result from specific healthcare investments or interventions. Community health workers are always seeking to promote positive health outcomes for their clients. So by providing support and resources, we are making efforts to improve health outcomes. So looking at some key important words that connect community health work to public health, think about what you see when you hear these words and ask yourself questions like, for health, what does good health look like for yourself, your family, children, husbands or wives, cousins, aunts, uncles, grandparents, or anyone else in your community? In public health, now that you have it defined, what does public health look like to you? And what's an example of a public health program you may know of or be involved in? In prevention, how does prevention help you or others stay healthy? What does prevention look like? What is an example of prevention for you or for perhaps a young child? In population health, defining what is a population? What do you think population health means? And for health inequalities, what does equal really mean? Inequality is the opposite of equality. So what do you think health inequality means? Start thinking about these and taking notes as we continue through this training.